Hi, Sarah Collins here, accredited women's health exercise physiologist. Today on the EndOut platform, we are going to discuss how exercise affects fertility and endometriosis. So we're going to touch on the top 3 benefits that exercise provides for when you are trying to conceive and managing endometriosis. So number 1 is going to be that weight management. When we include exercise, that is going to help us along with a healthy diet. Of course, we cannot forget what we are eating. That is also critical to this process, but exercise does help us with that weight management. And why we need to ensure we are in the correct weight range is it's going to help with our hormones, okay? We want to make sure our estrogen and progesterone are sitting in the right balance within each other, and we also want to reduce our cortisol levels, so exercise has a positive effect on our stress. And then we also want to manage our insulin levels, so we want to make sure that our blood sugar levels are at the right level, and making sure that we aren't borderline or at potential risk for then having type 2 diabetes, which is going to add another layer of difficulty when trying to conceive, as well as when you are managing your endometriosis. And touching on those hormones, exercise has a positive effect on our hormones, okay? It's going to help balance them like I touched on, and also ensure that there's some, routine, or rather some pattern to your menstrual cycles, because you're going to have even hormone distribution throughout the month via your exercise. So you're not going to have spikes of, insulin or cortisol if you are managing them accordingly through exercise, as well as other strategies through, meditations and eating well, in that sense. And number 3, it's going to help with inflammation. If we have too much inflammation in the body, again, it's going to affect our hormones. Our hormones are really critical here when we are trying to conceive, and it's also going to help manage our pain. If we have too much pain in the body, that is going to have a negative effect on our body. Again, it's going to increase our hormones such as cortisol. So what we can really see here is that everything is interrelated, and if we aren't managing one component, it's going to have a negative effect on another component. So the wonderful thing about exercise is it has this amazing effect where it hits a lot of those concern areas in one go. It helps with our weight management, it helps with our hormone regulation, it helps with our inflammation, and it helps with our pain. If you have any other questions on how exercise affects fertility and managing endometriosis, please head over to the EndOut platform and ask me a question. I'd be more than happy to answer and elaborate. Thank you.